Welcome to Learniverse. Today's topic is celiac disease. Its prevalence is only 1.4% globally. Before start, share the video and subscribe our channel. Diseases of small intestine are lactose intolerance, celiac disease, irritable bowel syndrome, inflammatory bowel disease, small intestinal bacterial overgrowth, celiac disease, or gluten-sensitive enteropathy is characterized by a combination of 4 factors. Number 1, genetic susceptibility. Number 2, exposure to gluten. Number 3, an autoimmune response. Number 4, an environmental trigger. Gluten refers to specific peptide fractions of proteins, which found in wheat, rye, barley. These peptides are generally more resistant to complete digestion by gastrointestinal enzymes and may reach the small intestine intact. In a normal healthy intestine, these peptides are harmless as the intestinal barrier is intact and prevents translocation. However, in persons with celiac disease, these peptides travel from the intestinal lumen, across the intestinal epithelium, and into the lamina propria, where they can trigger an inflammatory response that results in flattening of intestinal villi and elongation of the crypt cells, along with more general systemic immune response. Gluten sensitivity. The term gluten sensitivity is used commonly to describe persons with non-specific symptoms without the immune response that are a characteristic of celiac disease, or consequential intestinal damage. Gluten intolerance. Gluten intolerance describes the individuals who have symptoms and who may or may not have celiac disease. These 2 terms are used to describe symptoms such as nausea, abdominal cramps, or diarrhea after ingesting gluten. Medical nutrition therapy. Elimination of gluten peptides from the diet is the only treatment for CD presently. The diet omits all dietary wheat, rye, and barley, which are the major sources of the prolammin fractions. In general, patients should be assessed for nutrient deficiencies before supplementation is initiated. In all newly diagnosed patients, the clinician should consider checking levels of ferritin, red blood cell folate, and vitamin D. If patients present with more severe symptoms, such as diarrhea, weight loss, malabsorption, or signs of nutrient deficiencies, and also other vitamins, such as fat-soluble vitamins and minerals, should be checked. The healing of the intestinal mucosa that occurs after initiation of a gut-friendly diet improves nutrient absorption, and many patients who eat well-balanced gut-friendly diets do not need nutritional supplementation. However, most specialty gut-friendly products are not fortified with iron, folate, and other B vitamins like other grain products, so the diet may not be as complete without at least partial supplementation. Anemia should be treated with iron, folate, or vitamin B12, depending on the nature of the anemia. Patients with malabsorption may benefit from bone density scan to assess for osteopenia or osteoporosis. Calcium and vitamin D supplementation are likely to be beneficial in these patients. Electrolyte and fluid replacement also essential for those dehydrated from severe diarrhea. Those who continue to have malabsorption should take a general vitamin mineral supplement to at least meet DRI recommendations. Lactose and fructose intolerance sometimes occur, secondary to celiac disease, and sugar alcohols are not well absorbed, even in a healthy gut. A low lactose or low fructose diet may be useful in controlling symptoms, at least initially. Once the GI tract returns to more normal function, lactase activity also may return, and the person can incorporate lactose and dairy products back into the diet. In general, many fruits, vegetables, non-gluten containing grains, meats, and dairy products that are plain and unseasoned are safe to eat. Oats were once thought to be questionable for persons with celiac disease. However, extensive studies have shown that they are safe in the gut-friendly diet if pure. However, a very small population of patients may not tolerate even pure oats. Flours made from corn, potatoes, rice, soybean, tapioca, arrowroot, sorghum, garbanzo beans, nuts, millet etc. can be substituted in recipes. Patients can expect differences in textures and flavors of common foods using the substitute flours, but new recipes can be palatable once the adjustment is made. In gut-friendly baked goods, gums and cellulose can be used to provide the elasticity needed to trap leavening gases in baked goods. Labels of all bakery products and packaged foods are important. Gluten can also be added in foods during processing. For example, hydrolyzed vegetable protein can be made from wheat, corn, or mixtures of these grains. Avoid wheat, rye barley, oats, low-gluten flour. Caution: wheat-free does not always mean gluten-free. Avoid hidden gluten exposure. Over-the-counter and prescription medications, unfortunately, gluten is not always obvious. Review the list for some unsuspected products that may contain gluten. Check with your pharmacist or call the manufacturer to determine whether there is any gluten in your medications. Note: wheat must be clearly listed on dietary supplementation, as in a vitamin, mineral, or herbal supplement. If laboratory values stay elevated, possible sources of gluten cannot be found in the diet, it may be worth checking into other sources such as toothpaste, mouthwash, or lipstick. Gluten cross-contamination. A few crumbs of gluten that may not even be seen can cause damage to the intestine, so it is best to avoid these situations. Keep two toasters at home and designate one as gluten-free. Alternatively, there are now bags available that are designed to hold a piece of bread in the toaster. Delete gluten sources from diet, vitamin and mineral supplementation. Read food labels carefully. Thanks for watching.